What are some of the other challenges that you're seeing with facilities relative to this staffing issue?
Sure. I mean, obviously consistency. If you don't have a consistent staff, that can be very difficult for residents living in these facilities. They thrive on consistency and having that same person there.
Right.
That's really difficult when you don't have consistent staff. A lot of facilities are having to use agency staff because they need those workforce in there, right? They have very specific requirements and care standards that they want to continue to, be able to adhere to, and so they have to have whatever workforce they can come in. And that, again, that consistency, it's extremely costly to have agency staff.
Right.
So that again drives your costs up and your ability to be competitive and use those funds in other areas if you're having to use it on temporary staff. I mean, it's really difficult. And I just think that camaraderie of a team that you build when you have the consistent staff, when you're able to keep your staff there, when they're not leaving for $1 or $2 somewhere else or, other industries completely because they're burned out because a pandemic hit and it was exhausting and difficult and you're being tested and prodded and wearing PPE all the time. I mean,
Right.
Only just until recently was a lot of the CDC guidelines on PPE even lifted in long-term
I think in
care.
the last 2 weeks, right?
Exactly. And so, I mean, you think about even hospitals and clinics, they weren't having to wear this PPE for,
Right.
I don't know, maybe a year or somewhere around there. And long-term care, rightfully so. I mean, a very vulnerable population. A
Sure.
lot of deaths occurred in long-term care. However, long-term care knows how to handle communicable diseases, and they know when it's appropriate based on the guidelines that they're given, when it's appropriate to wear PPE. So I just think all of those things really contribute to some of the staffing problems.